Well, hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, along with my wonderful wife, Janet, and we are streaming live from the Moses Lake Professional Pharmacy Studio. And today we have the pleasure of having Leah Streich on our show today. She is going to tell us about her passion for functional medicine and how she got into functional medicine. If you've listened to us long enough, you guys have heard us talk about functional medicine, and functional medicine is treating the root of the problem and just instead of just treating symptoms like we do in traditional medicine. So, Leah, welcome to our show.
Thanks for having me. It's great to be here.
Yeah. So, tell us a little bit about your history and how you got into functional medicine.
Well, I grew up in Washington State and I went to WSU. My undergrad was in human science and nutrition. And so I graduated and became a registered dietitian. So I worked and had a passion in health and wellness and grew up doing gymnastics and cheerleading and sports. So as I was practicing as a dietitian, I just saw like a huge, gap in people's health and lifestyle. And of course, my training as a dietitian at the time was very, food guide pyramid based. And I was like, oh man, there's got to be more than, counseling on these little tidbits of nutrition and behavior change. So I decided to go back to school to become a PA so that I could have a broader scope of practice, which at the time you think, oh, a broader scope of practice, I can prescribe medications now and also educate on nutrition and different things. And so I went to PA school through the University of Washington.
Go Dogs.
Well, I was in Pullman for 4 years, so I'm kind of a Coug at heart. But yeah, my husband and I got married and we were up for going on an adventure after I graduated PA school. We were living in Spokane at the time, so I kind of applied all over, and we actually ended up in Alaska on the Kenai Peninsula. And we thought we'd move to Hawaii because who wouldn't want to live in Hawaii or something? But we had this opportunity, and the doctor that I was going to be working for was like, oh, well, I practice functional medicine, and, your background as a dietitian seems like it would be a good fit. I was like, great, that sounds great. But I didn't know what functional medicine was at the time. So we moved to Alaska to, go on the adventure. And of course, Alaska is beautiful and so many great outdoor experiences. And I got to learn, regular medicine and functional medicine kind of at the same time, which was super overwhelming because, PA school is just so fast and you're getting a ton of information. And then he's talking about supplements and, just outside the box stuff I didn't learn in PA school. And so it was just a lot to learn, but it was really fast to see how patients responded to, having the lifestyle approach and a little bit more digging at root cause. And I fell in love with it. And I just learned and did lots of different conferences through different functional medicine organizations, and then mostly just experience over the last 10 years working with patients has evolved a lot. And of course, the interest, as you guys have probably experienced in functional medicine, is grown, and just integrative health and holistic health and really taking charge of your own health is super exciting.
Yeah, absolutely. And it's I think it's kind of the future of medicine. I think, when you look at a lot of what's going on in our healthcare system, traditional treatments are just not working. And I'm not saying they're not necessary. I mean, Janet and I are two pharmacists. We understand that. But, when you look at our healthcare system, people are sicker than they've ever been, right?
Mm-hmm. Right. It's interesting, in the paradigm, it used to be mostly, a lot of patients see, all their doctors and specialists and get all the testing, and they're fine or normal or within normal limits, and they're still feeling sick and tired and, not living their best life. So it's exciting to be able to give them hope and, sometimes just kind of the motivation and lifestyle tools to really feel better. And then, I see it all the time. And it's interesting because, I always talk to people about simple symptoms like headaches, and we have a paradigm for, treating headaches or migraines. But depending on that individual, it's, sometimes we do stress management and that gets rid of headaches, or progesterone therapy and that gets rid of headaches, or food, gut microbiome. So that it's just so individualized, and it's fun to help people like find their own health journey and feel better.
Yeah, absolutely. Janet, what kind of questions do you have for Leah?
So, Leah, did you ever work in a big clinic, or have you always just been in a smaller setting and working one-on-one with your clients?
I feel really blessed. I've mostly just been in smaller clinics. In Alaska, I did do, primary care, urgent care, and then as the clinic grew, was able to do more focus on functional medicine. And then I was able to come back to my hometown and be able to utilize that experience in functional care. Of course, I have friends and colleagues that work in other healthcare systems, and it's just, a different paradigm. And I feel blessed. The time I get to spend with patients is essential. And it's hard because in this medical paradigm to be able to see people for 30 minutes to an hour and really dig and get to know and do functional testing. There can be a cost barrier and whatnot. But yeah, I've been lucky to kind of be able to work in this paradigm, and I think I would not be able to turn back now.
So I can tell you, I can think off the top of my head. In fact, we've had at least 2, maybe 3 registered dietitians on our show, and they kind of changed their view of what they were taught once they got into the system. And so tell us a little bit about that. What made you? Was there an aha moment, or what made you change? Your thought, all the things that you learned in school about what we're teaching people with diet.
Right. And of course, it's changed so much over the last decade. At the time, it's like it was really food guide pyramid based, and people would ask me, should I try like eliminating gluten from my diet, or should I try this? And I was like, oh no, it's just calories in, calories out. But, that didn't really create a lot of traction. I just didn't see the results. It was a lot more behavior change. Like, let's try to work on, one less soda a day.
Yeah.
And I didn't even at that time have the tools to really counsel on behavior change or stress management, or just the paradigm of our culture and stress, really being at the root cause of a lot of symptoms or exacerbating them. And now, as I learned functional medicine and gut microbiome and, the interplay with hormones and gut and food and, nutrients versus, and how they fuel our cells versus just food in general, and be able to create change for people and them getting results and feeling better quicker. And yeah, it was just with experience working with people and seeing the results was like the biggest eye-opening thing.
Janet, what questions you have?
So the one size fits all obviously is not what you're practicing, which is encouraging, right?
Yeah, right.
But there must be a little bit of pushback. So what kind of pushback do you get from your fellow colleagues? Because, functional medicine and traditional medicine sometimes don't mesh very well together. I mean, sometimes it does. It depends on your setting. But what kind of pushback have you felt from your approach?
Yeah, I think there's always a lot of skepticism as far as looking at, peer-reviewed research, and the conventional algorithms don't always include, our type of testing or just experiencing, a lot of medical providers just don't want to order, tests that patients have researched and want information about their own bodies. Of course, now there's a lot of direct to patient testing available, but I get patients that come in that just say, my doctor said supplements are worthless. And it's not that I'm a big supplement pusher either. I don't want people dependent on 300 vitamins, just like medications. But, sometimes identifying and treating some basic nutrient deficiencies to get their cells working, their methylation or genetics optimized, and they feel better. And they're like, wow, that did make a big difference. But a lot of times they're being told like there's just, no help that, vitamins can do, or, diet's not really going to change, the way that you feel, or it won't get rid of your headaches if you, do just certain dietary changes. So I think there's just that communication to patients, where I will get pushback. Sometimes I work more as like a primary care. A lot of times I'll be kind of consulting on the side. So you'll get a little bit of, clash in like what providers are saying. I think patients have access to, or we all have access to more information than other, which is great and confusing all at the same time. But yeah.
Well, I find it odd. I mean, I get into debates every once in a while with certain drugs. I'll just use an example, statins, for instance. And Jan and I, am speaking for her, but Jan and I we're two pharmacists. We don't believe in statins. And I mean, cardiologists just love them. And, the gold standard is statins, if your cholesterol's over 200 or whatever. But you don't look at the overall picture of the whole patient. In functional medicine, you dive in deep and you find out what all's going on. Well, I know when I've talked to cardiologists and they say, well, the studies do show that statins decrease mortality. And I just don't know if I buy that. I mean, first of all, you can manipulate data. Also, absolute risk versus relative risk. But you're telling me, Mr. Cardiologist, that, you can have a patient that's 150 pounds overweight that has a horrible diet, horrible lifestyle, isn't sleeping, doesn't move, and you're going to give them a statin and you're going to increase their mortality. I'm not buying it.
Right.
And then you tell them that lifestyle changes are important, and they say, well, that's not what the studies show. The studies show that statin is the most important. It's like, seriously, it's like, how do you explain that to somebody? I mean, how do you get that through their mind that, pharmaceuticals are not the answer?
Mm-hmm. Right. And that comes to a lot of education and the psychological state of people, and giving them the tools and different information, I guess, that they can kind of take charge of their own health. I give the same talk to patients about bioidentical hormones and, the data from the Women's Health Initiative and different, true risks versus, but also being able to provide really great things, obviously with hormone replacement, so it's difficult because you're up against very big messages and studies, and just kind of that push of an education and information. So it's really giving people, a bigger point of view and perspective. But I just find, and I'm lucky that, people often are searching for an alternative approach. And so I'm able to really work with them on that. And there are, some providers that are definitely more open-minded than others. But we can all agree that, and it might not show up in like medicine treatment, but that lifestyle is so important, and it's really the foundation of health.
So what are your thoughts when a healthcare professional says, oh, patients don't want to change their lifestyle, they just want to take a medication and then they'll be fine? What's your response to that?
There's no one size fits all. It just and it's really digging deeper. I really found, even with the functional medicine approach, you could have every nutrition supplement protocol in the world, but there is that mind body piece to it, and connecting with people at a certain level to initiate change and find that reason for change, I think is definitely an art that is needed in holistic and conventional care, because stress is such a big part of our culture. The quick fix is a big part of our culture. Comforts, we're learning now, longevity, sauna, cold therapy, fasting, like all these extreme things are making us better because we're used to being in, heat and air conditioning and eating, having food access, a lot of people. And so being able to push people outside their comfort zones and really create a balance to feel better.
That makes sense. So what do you like treating the most? Is there one thing that you have a passion for when it comes to functional medicine?
I keep trying to figure this out, because I was like, it would just be so easy if I could just really focus on, like just gut health or just hormones. I do a lot of women's health and hormone balancing, but in functional medicine, everything's so interconnected. So I was like,
Right.
I can't really give up anything, like brain health, cognitive health, performance, recovery. It's fun to be able to help all walks of life. Of course, now I have kids. I have a 4-year-old and 7-year-old. One of my kids has special needs, and I see a huge, need for health and integrative holistic care for kids in general, but especially with special needs, and being able to give parents tools beyond what's offered just conventionally. So,
Janet, do you have any comments?
I do, because, I'm thinking about, we talk about conventional and traditional medication and health, but really it's very short. I mean, if you look at the history of medication and you look at the history of doctors and shamans and the world as a historical perspective on healthcare, we put a lot into the faith of that provider helping us in ways. And we talk about the placebo effect, but I really believe that there's something in the holistic and what you're doing that brings back some faith, because that's something that has kind of been struggling with clients in the past 2 years, because the narrative that they've been told, or what they don't feel like they're being heard, they're just being rushed in and rushed out, or they're not receiving the care. I mean, people are kind of demanding that to come back, and that's a positive, because one thing that you touched on is a human as a whole, right? We are, as an organism, we are a whole. So you can't take away the brain function and the gut function, because they're two things that kind of go together, and we've kind of chopped people up in our healthcare right now. So I really think we're kind of returning back, like we're turning back a page to our roots of healthcare, and looking at the person from a spiritual person as well. Because if we're stressed and running around and there is no calming, and there's so this is really exciting from my perspective, because both Shawn and I, we were watching our clients walk out the door with bags of prescriptions, but they were returning worse, right?
right.
Not better. So I guess from my perspective, hearing your story and your clients, it's very positive. So that leads me into, I want to hear a story of something that just touched your heart or your practice in a way that would be interesting for our listeners to hear.
A success story.
Yeah. A success story. Okay. I'm going to try to rack my brain. I mean, just off the top of my head, there's a lot of like hormonal imbalances in young women, a lot of period issues, a lot of fertility concerns. So I think it's exciting when people can get pregnant and, sometimes even after failing like different treatments and be able to balance their hormones with stress management and detoxification and different tools to be able to create new life. And I think that's really exciting. There's just a lot of stories. I always think of, headaches and migraines and being able to get rid of debilitating chronic pain, I think is, it plays on the psyche and being able to do different dietary changes and whatnot. So I can't think of like a specific story right now. There's just a lot of good things that keep me doing what I do, for sure.
Yeah, I mean, those are great success stories. It sounds like you've had a lot of successes with fertility, and that's very, very rewarding for sure. And I'm going to guess a lot of them went standard route, for fertility treatments. We've had this happen in our pharmacy before, where they went standard route for fertility treatments and they failed, and then they come to a functional medicine type practitioner that knows about hormones, and they're pregnant within a couple months. We've got half a dozen of those stories at least that we can think of. That's very rewarding.
And I definitely resonate with coming back to like the ancient wisdom and spirituality. I'm actually just finishing up doing yoga teacher training, and it's certainly interesting to learn about different elements of like Chinese medicine and things coming up in science that are proving what we saw in ancient medicine times, and thinking of the placebo, like Joe Dispenza's like you are the placebo effect and like the chemical effects in the brain. And I think it's really exciting to give people those informations, like that information and science that's coming out, that you can really change your health.
So it looks like we have some comments, Steph. Can we stream those comments? Is that your fan club there?
Yes.
Sue Clark Borg.
That would be my mother.
Answer. That's awesome. I love it. I love it. You're popular. You're a celebrity, Leah. Thank you. And I think we have one more. Is that another one in your fan club?
Yes.
I love it. I love it. So, yeah. Well, what our goal with this podcast is to educate and empower individuals to take charge of their own health. And you've already said that at least twice that I know of. And that's really, I think, what we have to do is educate and empower people to take charge of their own health. They only talk to a pharmacist, or they only talk to a physician's assistant, or any healthcare professional, an hour a month at best, but they deal with their own body 24 hours a day. So in order to really, really take charge to be the best health, they have to be responsible, and we have to educate them to help them do that. That's really all we can do, right?
Right. Definitely.
So go ahead. Were you going to say something, Leah?
Well, I always tell people, sometimes you get caught up in like the sick paradigm or, symptoms and in the end, it's about living your best life and really being happy and being able to enjoy the things that you love doing and the relationships and community and being part of that. So I think bigger picture perspective is like a huge point that I always make with patients too.
So you kind of already talked about your passion a little bit, professionally at least, but what other passions do you share? Maybe personally, what do you have a passion for?
I love, and I have to attribute this to my husband, but I do love being in nature. And I didn't necessarily grow up that way, but when we started dating, he introduced me to backpacking and hiking. And then, of course, living in Alaska, being able to see beauty untouched and it's good for the soul. It's, there's science in that too. So
absolutely. In fact, tune in a few weeks because we will have Dr. Amy Beard back on our podcast. She's a functional medicine doctor in Arkansas,
Okay.
and we're going to talk about nature therapy. She lives in the woods in Arkansas, and it's a
I love
perfect,
it.
it'll be a perfect location for that. And it is. There's, think about how much better you feel when you get outside. And there's
Oh
so many
yeah.
things. Yeah, there's so many things. And, some people say, oh, it's vitamin D and sunlight. It's way more than that. It's just way more than that. It's things that
Right.
we will never, ever be able to explain.
Mm-hmm.
And that's part of functional medicine. It's like, movement is medicine. What all does movement do when we stimulate our bodies to move? We don't know. We just know it makes us feel better. I mean, there's a few things we do know. There's a lot we don't know. That's why diet, exercise, movement, sleep are so important because that's how our bodies were made to function.
Yeah,
It looks like you had
definitely.
another fan club from Alaska. Did you see that comment?
I know. Yeah, we miss Alaska too.
Speaking of nature therapy, Alaska
Yeah.
is the perfect nature therapy.
Oh,
Although I
it
don't
is.
know if I'd like the winters there. I imagine it's starting to get kind of cold and the nights are getting long.
Yeah, I have been saying that I've really enjoyed this, as you guys have experienced this wonderful fall weather that we've been getting is
Yeah,
pretty
crazy.
nice.
Yeah. So as we wind this podcast up, Leah, I want to thank you for helping us realize our goal. And I also want to ask, what is the best way to get a hold of you?
So I work at Optum Clinic in Spokane, and we have our website, and we're online like Instagram and normal social media. So yeah.
Cool. All right. Well, I thank you, Leah, for helping us realize our goal of educating and empowering individuals to take charge of their own health. Keep doing that for us, please.
Thank you. Thanks for
Inspires me.
having me, and
Thank
you
you.
too.
And thank you for being on. All right. Well, tune in Thursday because we will have on our midweek podcast, we will have another guest on. And let me see, I should, if you've seen me watch, I do this every time, even though I should know what it is ahead of time. Oh, that's right. I just remembered. It won't be Thursday. It'll be Friday. We have a special edition of Health Solutions with Shawn and Janet Needham. We will be streaming live from Pennsylvania. We will be talking to Dr. Courtney Ciccoletti. She is a pharmacist, our resident pharmacist, I like to call her. And we'll be talking about hair analysis. Janet cut off some of my hair and we put it in a sample to see what kind of hair I have. We're going to do a trace mineral analysis of my hair to make sure that I'm healthy. So tune in for that. I'm not sure the time yet, but there will be, I think it's like 11 o'clock Eastern time, but not sure of that. So just stay tuned. Watch me on my Facebook page, on the Mosaic Professional Pharmacy YouTube site, on Twitter and LinkedIn, and you can see all of this live. So tune in again, and I thank you for tuning in today. Thank you. Health Solutions with Shawn and Janet Needham.